Hello and welcome to Tech Weekly. Glad to have you join us again as we are going to be recording monumental activities in the tech space, adding our quota to its development. I am Folarin Ishola. Today we are going to be talking about telemedicine and how this particular tool is revolutionizing the healthcare system of Nigeria, and many other things it will do for us as an advantage in Nigeria. But before that, we'll take the news updates. Digital payments company Visa has expanded its global value-added services business with 3 new AI-powered risk and fraud prevention solutions. The new products, part of the end-to-end Visa Protect suite, are designed to prevent fraud in direct account-to-account and card-not-present payments, as well as transactions both inside and outside Visa network to reduce. According to the company, Visa Protect is part of a broad range of Visa value-added services that have grown to nearly 200 products across 5 high-demand categories, including underwriting advisory, issuance, open banking, and protection to help customers deal with a growing number of complexities. Visa said it has combined decades of expertise and significant investments in both AI and fraud prevention, with $10 billion in technology and innovation in the past 5 years alone to help reduce fraud and increase network security. The company noted that security and fraud prevention are fundamental to Visa. It revealed that Visa helped block $40 billion in fraudulent activity in 2023, nearly doubling from the previous year. And on national identity number, MTN Nigeria's internet subscribers dropped in January due to efforts to comply with the Nigerian Communications Commission (NCC) mandate to link all SIM cards with a national identity number. MTN, the largest telecom operator in the country, saw over 2.8 million subscribers drop from its internet business, leaving 67.8 million subscribers in January from 70.6 million subscribers in December. The decline was the most MTN Nigeria has seen since May 2023. The drop, however, didn't affect Airtel and Globacom, as both telcos gained subscribers in the same month, according to the latest data from the regulator. Airtel gained the most subscribers in January with 890,935 subscribers joining the network and helping to solidify its position as the second largest internet service provider with 45.9 million subscribers. And Globacom also gained 192,313 subscribers in January. Subscriber gains from Airtel and Globacom helped to reduce the impact of MTN's subscriber decline on the industry. Airtel grew its subscriber base from 45 million subscribers to 45.9 million subscribers. Globacom also grew its subscriber base from 43.9 million subscribers to 44.1 million subscribers. Now, on Meta service interruption, WhatsApp was backed up on Wednesday after an hour-long outage at the smartphone messaging app disrupt services for thousands of people globally. WhatsApp said in a post on social media platform X that the issues had been resolved. At its peak, the outage impacted more than 24,000 WhatsApp users in the United States, while Instagram users also reported over 5,000 outages, Down Detector data showed. Around 1,000 people were still facing issues with Instagram in the United States per Down Detector, which tracks outages by collating status reports from a number of sources, including user-submitted errors on its platform. The WhatsApp outage had impacted thousands of users in India, the United Kingdom, and Brazil per Down Detector data. Meta did not immediately respond to a router's request for comment. And finally on the news, Tecno is gearing up to launch the next Camon series device, which promises to be the next evolution in mobile photography. The Camon lineup has always been known for its innovation in capturing and sharing cherished moments. Now, Tecno is taking it to the next level with a groundbreaking camera innovation that aims to redefine what's possible. For years, the Camon series has been a driving force behind countless memorable shots, empowering users to unleash their creativity and capture the world in stunning details. With the upcoming device, Tecno promises to exceed people's expectations and deliver an unparalleled photography experience that's second to none. The new Camon device will feature cutting-edge technology and unparalleled performance, setting a new standard for mobile photography and content creation. Imagine being 10 steps ahead of the curve, armed with a device that empowers you to capture the perfect shot every time. And that's all we'll take on the news. Quickly, we'll go on a break, and when we come back, we'll have our discussion segment. Stay with us, we'll be right back. Glad to have you back. And now with me in the studio is Hilary Onyejekwe to discuss a topic that we've chosen to see how the healthcare system can become better. It is called telemedicine. Today we're going to be discussing with Mr. Hilary Onyejekwe, and he's going to be giving us the nitty-gritty of telemedicine. Welcome to the studio, Mr. Hilary.
Thank you very much.
So now we've seen that telemedicine is maybe the new thing in Nigeria, where you don't have to go to the hospital, you just have to be in the comfort of your home and you'll be attended to medically. Can you give us a background to what telemedicine is?
Okay, telemedicine is, well, I call it an add-on to the existing medical system, where, like you rightly said, you get to consult a professional licensed doctor without leaving your home or your office. Because traditionally, if you are a worker, a government worker in private sector, and you just need to go for a checkup, or you don't understand how you feel. You must have to go to the hospital and, stay on the queue, wait for your turn before you see a doctor. But on the way with telemedicine, you just schedule your appointment, and on that, when it's time, you just see a doctor and probably get diagnosed and get your consultation done.
So on what platforms are these scheduling done? What technologies are involved?
Okay, the technologies involved are the technologies that are already existing, not like it's something new. Okay, like one of my clients is, they call them Complete Care. It's a healthcare, it's a telemedicine platform, Complete Care. So everything is inbuilt in the system. So on the platform, some of them have web apps, some of them have mobile apps where you can do the scheduling. But the scheduling, the consultation, the video conferencing with the medical personnel and everything is on the app.
Okay, so now do you think this is something that is doable for people who are in remote areas, who cannot probably access a computer? How do you think this is really accessible for them?
When it comes to remote area, that's basically the challenge, not only in telemedicine, but in other aspects, because for you to use such platforms, a telemedicine platform, you need internet-enabled device, you need network, a good network. Since it's going to be a video call between you and the doctor, so you need a good network. So those in the remote areas I would just say depends on if they have such, network. And the technical know-how of these, some of the barriers in telemedicine, especially in Nigeria, or would I say in Africa. Some of these barriers include technical know-how. Some people cannot, like my grandmother now cannot operate an Android phone, not to talk of giving her a tablet or a laptop. Network issue, some places you go, you say, we only have Airtel in this village. Sometimes some places no network. So these are some of the barriers. But yes, in towns like Lagos, Abuja, Port Harcourt, it's a welcome idea, and I see that the trend is actually increasing exponentially, because it started in 2019 or Well, I say, I know it started, some of these companies started before 2019, and in 2024, the awareness is high.
Okay, so what are the services? Are there limited services on telemedicine? Because, you know, if you're going to the hospital, if you have an issue and you're going to the hospital, sometimes they run tests on you. And sometimes the doctor just prefers drugs for you to take. On telemedicine, how does it work?
Okay, on telemedicine, anyway, to put things straight, I'm not a medical practitioner. Why I know much about it is I work with a company. I'm working with a company. One of my clients is into telemedicine. So how this thing works is when you consult with a doctor, and probably, doctor, I think I started having headache. You know, these professionals, they have a way of using your questions, getting answers from you to point them into the right direction. So on these platforms, they can't perform tests on you because it's a virtual meeting, you know. So they will just diagnose, how do you feel, what's your work like, what's your stress rate. When they ask all those kind of questions, and probably they feel that, okay, you still need to conduct ABC tests or whatsoever, then they'll refer you, they'll ask you to go and run a test, a particular test, depending on what's wrong with the person. So when the person runs the test, you can reschedule, be like, okay, can we meet, today is Thursday, can we meet on Saturday by so time? I'll reschedule for Saturday so that when I get a lab test, we can, you know, he can use that lab test to prescribe medications. So on the platforms, on these telemedical platforms, you don't run tests on there. You only get consultations, you only get prescriptions, you only get advice, you get all that. But the practical aspect that involves two people is not possible yet.
Okay, before I go into the benefits of telemedicine, I want to know, are these things cheap for an average Nigerian?
Yes, I would say it's cheap for an average Nigerian, because if you say cheap in terms of the financial aspect alone,
affordability
yes,
for a normal Nigerian on the street.
Yes, like this, my client I'm talking about, to see a consultant, a general medical doctor that can point you to the right direction depending on what's wrong with you, is about 4,500. You know,
consultancy fee.
Yeah. So for you to consult,
is that not expensive than a physical visitation to the hospital?
Okay, you put that side by side with, if you want to go to a general hospital, let's say teaching hospital in Gwagwalada, where you pay like 500 or 600, or we'll say general hospital. Then when you come by 7 a.m., you are number 75 to see a doctor. Okay. So you see that you are paying either in cash or with your time. So you that's a worker, you that is a student, you that is a parent, you have to wait until you came to the hospital by 7 after dropping your child in school, and by 2 p.m. your child has closed from school. You've not yet seen a doctor. Going back will be a waste of your day. Staying ahead means, you know, so in terms of, I think by that, I've consulted a doctor before that physically, that consultation is 35,000 just to see him. It
depends on your health condition.
No, it depends on the specialty. Some of these people be like, okay, just like every other profession, you know, some people rate themselves like, I feel like I'm one of the best in town, so I shouldn't be taking what others are taking. So, and you know, we Nigerians now, when you perceive something to be expensive, you want to go there because you feel you are getting the best from there. So I think 4,500 shouldn't be too bad, especially when it comes to health for somebody.
But an average Nigerian cannot afford that, especially in this economic situation.
Yes, well, if you look at the economic situation, I think 4,500 is too much. When such person dies, no family have ever said there will be no burial or they will not use casket for this person because the economic situation. People will still be there to contribute, you know. So I just think it's just about value. Do you place this health, the way I'm feeling, do I place it high enough? Do I think it's worth 4,500 to make me feel better? But if not, somebody can just walk into a chemist. Okay, this is the way I'm feeling. They will mix 1 or 2 drugs and give to you. When there's complication tomorrow, you know, so many people have died from that instance. Okay,
so now let's go into the benefits. Now, I'm not just talking about the benefits to the individual alone, talking about the benefits to the health sector of Nigeria. You know, we've been experiencing brain drain, experiencing a lot of other issues in our health sector. Yeah. How is telemedicine going to help the health sector?
Well, so far I think it's helping because some of these doctors, okay, one of them is some of these doctors only use they onboard on these platforms and they consult, they set their availability on the platform when they know they are free. They are not in the hospital. Maybe you're working in a teaching hospital or you're working in a private hospital. You know that your time is from so time to so time, you know. So when they are free for the doctors, they can set their availability then and see other patients and still make extra money, which is also good for the platform. Then the flexibility helps the patients too. You know, somebody that works like somewhere like in a bank, you don't have the luxury of time, you know. So you can just see a doctor that is available between, let's say, 7 and 9 p.m. and schedule with the person. So instead of going during the day, you can still meet up with that. Then on the other hand, some HMOs are equally tagging along with these telemedical platforms because that is to say that you can use your HMO insurance card on the platform. So instead of paying, your HMO pays and things like that. So it's a win-win for everybody. It's a win-win for everybody. Both the HMO, the doctors, the owners of the platform, the patients that want to use it. It's a win-win for everybody.
And so what about the healthcare sector?
So for the healthcare sector, I think it's going to boost is going to boost the confidence in the healthcare sector because the way it is, since it's virtual, some of these are doctors that have JAPA, you know, some of them can still consult from there because it's you don't have to be with the person physically. Since it's an online platform, the person just have to be there, log in his or her own platform and, you know, consult with you. So I think this bridges the gap to an extent, you know.
Still on that, I don't want to focus on people who have gone outside the country. I want to focus on what we're experiencing right now in the country. Can a general hospital wake up today and say, we now offer telemedicine? And do you think they'll thrive?
A general hospital, yes, can. But you know Nigeria, everything is procedure. If let's say Wuse General Hospital decides to go towards that path, I believe it's going to help a lot. Because one major thing that stops somebody like me from going to general hospital is just the queue.
The time.
It's just the queue. Because when you come there, as early as you come, you still be number whatsoever, you know. So someone like me prefers that I just come, so time, we'll have it and we leave, you know. So the general hospitals can, if they want to, if the directors of this hospital will look into it and, you know, do something about it towards that direction, I'm sure it will benefit both the hospital management, it will benefit both the doctors and equally the patients that are in the hospital. Because some people are very religious about this thing. You know, they just say, is this hospital I'm going to? Even if this one is offering the same thing this one is offering, they'll just want to be there, you know. So it's going to help a whole lot of people. Then let's just assume that, okay, the ones that are still wanting the traditional way can come over. Then with these hospitals, like the general hospitals you talked about, if they onboard, they can equally help that. If after consulting with you, they can direct you to their lab of the same hospital, you know, things like that. So I think, yes, it's doable for the general hospitals to join.
So now many people would want to know if there are some medical conditions that cannot be attended to through telemedicine.
Okay, that's a bit medical, but I'll just try to answer.
Because okay. I know this involves video calls, phone calls, and there might be some emergency situations that probably telemedicine cannot help. Okay,
I would say I had an experience. I'll just give a short story of what my personal experience. Some time ago, when I was in Ikeja, all of a sudden, it was 2 a.m. A friend of mine that came to visit just started vomiting, just started throwing up, and it was 2 a.m., it was raining, and I was so devastated with what was going on. And all of a sudden, I remember I had a doctor friend. I just called him on the phone. This is what's going on. He asked me, what did he eat that night? I told him. He was like, was he sick? He just asked me a few questions, and I answered. He just told me what to do. And when I did that, the guy was better, you know. So doctors can equally help from afar because of their wealth of knowledge. They understand the human anatomy. They know what to do to get what, you know. So I believe not all medication, not all conditions can be treated totally on it. But like I said earlier, most of the time, I know that when you speak after the first consultation, they'll recommend some tests. Go and run test A, test B, test C. Then we'll reschedule for another day. With that, they can know what's wrong and prefer solution and even give you drug prescription. But carrying everything A to Z on the platform, that means the person is just having like cough or catarrh. You know, when you come and they diagnose you with cough or catarrh, they'll just tell you, go and buy this, go and buy this, go and buy this. And when you take it, but for more complicated issues like fractures or internal other things, I don't know, it can't be. Hopefully in the near future, telemedicine should be able to, because there are breakthroughs and more tools that are coming out daily, and I believe that hopefully we'll get there soon.
Okay, now let's go into the challenges of telemedicine. You've mentioned the network issues, not being able to get into the remote areas. Yeah. What other things would you regard as limitations to telemedicine?
Okay, some of the limitations I would say is, apart from the network issue and all that, I believe education of our people.
Awareness.
Awareness, thank you. Awareness is a major blow on that, because so many people just want it the way it used to be. This is how we do it. You know, so many people don't want anything that is a bit 1 degree away from the norm. They are not in. So I believe this awareness is something that that is a challenge currently, and people have to spend a whole lot of money on advertising, you know, just letting people know that this, instead of going to the hospital to wait for a doctor.
But you know, not everybody owns smartphones.
Not everybody owns smartphone, but almost everybody is on social media, you know. And most people listen to radios. Most people watch televisions, you know. So I believe advertising is not just about if you have smartphones. In the year 2000, how many of us have smartphones? But news pass across, you know, and things like that. So, and you see that why some of this is like this is because I'll say our literacy rate is not as high as it should be as a country. So that's why I think, and our religious belief too is another thing. Some people have very funny religious belief or cultural belief too. Let me not just say religious, both religious and cultural. Very funny ones that if you hear, you even laugh. So somebody will be like, oh, my wife is coming to deliver a baby, and the midwife that is there is a male. Say, you can't deliver, even though she's dying. Yeah. She'd rather die than to allow a man attend to your wife that is giving birth, that is the process of labor. So you can see that these things are still very funny. So the socio-cultural belief is still a challenge to telemedicine.
But I think in a case like this, the choice, there should be a choice for patients. If you want to speak to a male doctor or you want to speak to a female doctor, that could help in certain ways.
Okay, in that case, the platform that my client owns, I don't know if they have, I'm not sure they have that. What they just have is a specialty. You want to speak to a dermatologist, you're having skin reaction, probably you didn't know, you just change your soap or your cream, and you want to speak to a dermatologist. Ordinarily, you shouldn't be worried if a dermatologist is a male or a female. Yeah. You know,
so certain situations.
Yes. So what I just need, I don't need a general doctor. I don't need a pediatric doctor. What I need is a dermatologist. You know, so somebody shouldn't be, you know, thinking about that. But in some cases, when it comes to, let's say, something that has to do with your reproductive organ and things like that, some male will feel more conversant or more okay talking to a male doctor. So in that case, you know, on the platform, you would see the people that are available. Let's say I want to talk to a reproductive health doctor, and on there, I'll see that like there are 5 of them. I'll be the one to choose. I'll see their availability. So I'll be the one to choose. So in that case, if there is a female doctor and you want to speak to a female doctor, then you can select. But if there is no female doctor in that specialty, then that means you can't do that.
So what will be your recommendation to the federal government on introducing telemedicine to their healthcare system?
Well, I would say the recommendation is just that technology is just here to stay. So the earlier we welcome it, the better for all of us. So I would just say if the government will look at it and try to incorporate it in all the general hospitals, I'm sure number one is going to reduce the crowd. Number two, if it's going to be a general hospital, I'm sure it will not be up to that 4, 5 or 5,000 that they are charging. They will charge low, which is going to create competition between those private hospitals and the general hospital. And you know that what competition does, just like EPIs. EPIs just started and the price dropped, you know. So when they introduce the competition, I'm sure this affordability you were talking about earlier for low-income earners will still come in.
All right. Thank you very much, Hilary Onyejekwe, for joining us in the studio today.
You're welcome.
All right, that's all we can take on the discussion segment. Quickly, we'll take the top 10 health tech in Nigeria. Welcome to the top 10 health tech startups in Nigeria. On number 1, AfriHealth. AfriHealth is a pioneering home healthcare technology company distinguished by its commitment to change the healthcare landscape in Nigeria. Specializing in comprehensive cloud-based software solutions, AfriHealth empowers healthcare providers through its Rigor Plus app. The platform is designed to be more than just a tool. It is a transformative force, streamlining patient data management, facilitating seamless telemedicine services, and offering insightful health analytics. On number 2, Helium Health. Helium Health provides healthcare software for electronic medical records, hospital management, billing medical loans, and analytics. They are deeply committed to supporting both private healthcare providers and public health stakeholders with finance, technology, and data to achieve a vision. On number 3, Checkit. Checkit provides manufacturers in pharmaceutical and fast-moving consumer goods with sticker labels and software packages that enable them to track products while also allowing their customers to authenticate them. Checkit can also provide producers with serialization standard-based services with data matrix code printed on product packages. On number 4, Health Tracker. Health Tracker is a digital health platform making medical diagnosis accessible and affordable with at-home lab testing and digital results. They book lab tests such as COVID-19 PCR tests, STD tests, full body checkup tests, domestic staff tests, pre-wedding tests, malaria and typhoid and willingness tests, and fertility tests, and many others. On number 5, CRIBMD. CRIBMD provides affordable subscription-based telemedicine and doctor house calls on demand to patients in Nigeria where primary care is in short supply. The CRIBMD experience brings preventive, primary, and urgent care to a patient's doorstep. They empower medical teams to develop deep patient relationships through unhurried visits, comprehensive care, and immersion in the patient's home environment. On number 6, LifeBank. LifeBank is a healthcare technology and logistics company based in Lagos, Nigeria. It is a health startup that facilitates the transition of blood from labs across the country to patients and doctors in hospitals. It was founded in 2016 by Temi Giwa Tubosun. As at January 2017, it had delivered over 2,000 imperial pints of blood to patients in need across the country. On number 7, MDAS Global. MDAS Global, co-founded in 2017, focuses on providing tech-enabled healthcare services to underserved communities in Nigeria. The company operates in 17 diagnostic centers across 10 states, offering services such as imaging, cardiac diagnosis, and laboratory testing. MDAS Global also uses its Sentinels app to offer patients access to personalized care programs, including preventive healthcare options. While the company initially focused on direct-to-customer services, it has found success offering its services to businesses, providing them with employee health screenings and government-mandated testing. On number 8, Better Care. Better Care is a 24/7 virtual hospital that provides quality and affordable healthcare by helping people all over the world connect with doctors, pharmacies, laboratories, hospital, and other healthcare services with convenience and ease. The mobile health startup Better Care aims to bridge the current gap in healthcare in Nigeria by providing affordable and quality healthcare to the masses through the click of a button. On number 9, SynLab. SynLab brings international expertise, world-class healthcare, new specialized services, and enhanced medical diagnostics never seen before in Nigeria to our existing network of high-quality medical services. On number 10, Remedial Health. Remedial Health is the trusted all-in-one app for sourcing medications, medical consumables, and devices for your pharmacy or medical practice. Remedial Health combines the use of pharmaceutical procurement innovations, inventory financing solutions, and pharmacy operations, patient management solutions to improve access to genuine and affordable medicines in Nigeria.
Welcome back. I hope you learned a thing or two about telemedicine and how you can remotely access telemedicine in your area. That's all we can take on the show today. Do join us on the station next time. I am Folarin Ishola.